Hello. This is Mrs. Fairchild. I wanted to go ahead and make a couple of videos. I know I have made one or two, but going forward, as you are studying your medical terminology, I thought would be good maybe for those of you who like to maybe listen to a video, to have some videos to help you with your studies as you go along. So I'm going to go ahead and use the PowerPoint that is already on Canvas for you. Let me share that with you real quick. And we'll just get started, kind of just quickly going through the slides, and I'll tell you, hopefully guide you along the way to help you with your studies. Let me go ahead and hit the share button. I think we're sharing now. So we are talking right now about chapter 9, and this is the digestive system. It's a very, of course, everybody's system is very essential to the functioning of the body. The digestive system, as we know, of course, is so important for the purpose of digesting our food and getting the nutrients that we need from our food. The nutrients as far as vitamins and minerals, and also those macronutrients, proteins and carbohydrates and fats that we need to have a good balance of good nutrition to keep our body functioning. So let's go ahead and start. I'm going to just kind of go over the learning outcomes just quickly. I mean, you already know those, so you can read along with that if you would like, but we are going to go ahead and kind of dive into the chapter. So we're talking about the digestive system. An older name for this is the alimentary canal. We don't seem to really use that anymore, but that is kind of the original name of the digestive system, the alimentary canal. And the aliment, that first word there does have to do with nourishment. Of course, canal is really, if you think of just a very long tube, and really kind of that is what the digestive tube or digestive system is. It's a really long tube. It goes from basically the mouth. Here it says the tongue, but we ingest food, we place food into our mouth, and that begins that digestive process. And then it just travels, the food travels and is broken down along the way into a substance where we can gather nutrition from that. So, as you know, it goes from the mouth down through the esophagus into the stomach. At that point, the stomach churns that food, adds digestive enzymes that will then break down that food. At that point, then we call that chyme. And then that enters the beginning of the small intestines. The small intestines is actually broken down into three portions. The very first portion is the duodenum. We kind of say there, sometimes I say duodenum. It helps me spell the word a little better if I say it that way. But the duodenum is the first portion. That middle portion is the jejunum. And then the end of the intestines is the ileum. Now, of course, in this diagram, everything is kind of stretched out. So we know that normally the intestines are found in kind of your mid to lower abdomen, and they're all kind of scrunched up together in the middle of your belly, basically. And then around the small intestines, then is that large intestines. And we'll see some better pictures of that here in just a minute. But basically, we know that a lot of our vitamins and nutrients are absorbed in that small intestines. And then as all that byproduct kind of left over at that point, kind of just a lot of water and fiber that hasn't been broken down yet, that kind of enters into the beginning of the large intestines. It travels up the ascending, across the transverse, and then down the descending. And then basically, as that final kind of waste product with a lot of water, that water gets kind of absorbed back into the body through the large intestines. And then your final waste product is usually a normal kind of soft but formed bowel movement that exits through the anus. So, are the functions of our digestive system. We put food into our mouth. We choose which food we put into our mouth, and then we chew, and that begins that digestive process called ingestion. And then that moves down from the mouth, down the back of the throat into the esophagus. And there is a special type of peristalsis that occurs. Peristalsis is just kind of movement within a tube. And so there are muscle contractions that help kind of guide that chewed food down into the stomach. And that's where really digestion then kind of takes place or begins. You have the stomach is churning that food, breaking it down. It's also adding different enzymes and different acids that are actually made kind of by the stomach. And then at that point, it is called chyme. At this point, it enters into the that first part of the small intestines, and this is where we also get some added secretions from the pancreas and from the um, the the gallbladder, which bile that actually comes from the liver is stored in the gallbladder. Then that is secreted into the duodenum, and then that helps also break down the food. And at that point, we begin then, as the food is moving through the intestines, we are actually absorbing a lot of those nutrients. Along the way, some of your secretions include also mucus to kind of help just lubricate and just aid in the movement of the food products through the intestines, through both the small intestines and then again, their proteins, fats, carbs are being absorbed. And then fiber finally and other waste products are remaining in that waste product that as it enters into the large intestines, along with a lot of water. And then we are absorbing the water back into the body and then eliminating the waste product via the anus. So, some of the different words that have root words that are involved in some of our medical terms. So, um, aliment refers to nourishment. And again, the alimentary canal. So that is the important body system where we break down foods and we absorb those foods to get nutrients. Zymes, when we think of enzymes, those are special chemicals that are secreted by the body into um, different parts of the body, but usually when we think of those, we think of chemical breakdown and enhancing chemical reactions. Your enzymes enhance chemical reactions, allowing them to occur more quickly. And so they really are important in a lot of the different breakdowns of our food and both food within the gut. And then as we are absorbing that protein, fats, carbs into our bloodstream, enzymes help the chemical reactions. Digest refers to kind of the breakdown of the food itself. Gastr, refers mainly to organs, the stomach, and anything that has to do with the stomach. And then lip refers to LIP. I think of lipase, and so that is the enzyme that breaks down fat. So referring to lipids, lipase, etc. And of course, that would definitely fall within the GI system when we're talking about that. So, some other words to go along here as we're making sure that you identify the root elements. But mastication is referring to chewing. Also, degglutination is the movement of the food from the mouth down into the esophagus and on into the digestive system. Peristalsis is muscle movement that occurs normally within tubes. And so we think here of peristalsis within the esophagus as that food bolus is making its way down into the stomach. Smooth muscles along the way within the esophagus are helping that along. Then also in our intestines, small intestines, large intestines, muscles there also continue to move that food product through the system so that ideally everything's moving along and we're not having any of those medical issues where you might think of as constipation when the intestines are moving very slowly. And because of that, too much water is absorbed from the waste product. And then so the patient begins having constipation and having issues with hard stools, etc. Of course, elimination is the act, and in this term here is the act of eliminating or removing the waste product from the body, normally via the anus. And then the secretion is just, again, thinking of the different enzymes and the different chemicals and additives that our bodies secrete that kind of add or put into the food that we ingest. And then, of course, as it's traveling on through the chyme that is being digested. And that helps with the breakdown of the food, again, into nourishment that we can then absorb into our body within the small intestines. So looking a little bit more closely now at the mouth, the pharynx, and the esophagus. Um, Make sure that you, and of course, if you've taken anatomy already, you probably have done a very good deep dive into the anatomy of the digestive system itself. We know that teeth are very important, a very important part of the digestive system because they help break down that food initially just through the act of chewing. We know that we have different glands, the salivary glands, add saliva to that which we're eating, and that there is a chemical in there that initiates the breakdown of some of our sugars. That's why sometimes when we do eat sugars, we get that taste of sweetness because already it's being broken down at that point. Um, so going on. Make sure you do review all the parts of the mouth there, okay? And the tongue is a very important part of the mastication process as well. There are different parts of the tongue, so review that. So going on, this is just a kind of look at the tongue itself. Make sure you're understanding the different parts of the tongue, the papilla on the tongue. And a very important thing here to me is the epiglottis. The epiglottis is that tissue that when we swallow, it covers the trachea. So very, very important part of the digestive system, prevents us from aspirating our food when we eat. So make sure you understand what the function of the epiglottis is, okay? And understand that the papilla of the tongue, taste buds of the tongue, um, and that's a very important part of the eating process, of enjoying our food. That's part of nutrition, enjoying what we're eating. So understand that. And then of course the teeth are located and the mouth is made up of the upper jaw, which is the maxilla, and the lower jaw, which is the mandible. And understand how basically the teeth are formed, the different parts of the tooth, each individual tooth, the dentin, enamel, and the pulp. Of course, the enamel is that white coating over the teeth, and that is an important element of keeping each individual tooth safe is by having good dental hygiene so that we are taking care of that enamel and not allowing it to break down. When we have breakdown of the enamel, that is when a patient may end up having cavities. And if cavities aren't taken care of, then that can lead to illness, of course, poor hygiene, poor dental hygiene specifically, and sometimes it ends up with a loss of teeth. And then a patient is looking at either having to get teeth, like false teeth or dentures, or maybe like surgery to have surgical teeth implanted so that they can continue chewing, which is, again, a very important part of the gaining nutrition, because if they're not able to chew, then there are then certain foods that they will not be able to eat as well. And then they could hurt the nourishment that they're getting. They won't be able to get good nourishment as well as if when a patient has good teeth. So going on, just again, looking at those different root words, make sure you're looking into your book to make sure you have a good understanding of those root words there. Salivary glands are an important part of the digestive system. As we mentioned, there are different locations and different salivary glands. Again, the function of the saliva is to begin the breakdown of starch digestion, also fat, and of course it lubricates the food for swallowing. And then the esophagus is that tube that connects the pharynx or the like the from the mouth into the pharynx and then into the esophagus. And it is those peristalsis, those peristaltic waves that move the food bolus downward. So the tube itself is the esophagus. And then at the end of the esophagus, there is a portion where at the end of that there is a sphincter there. That sphincter prevents food that once it enters into the stomach and the food begins the digestive processes there, we really don't want that food product to go backwards to flow up into the esophagus. And so that is the purpose of the that sphincter that is there. And so the esophagus is the tube linking the pharynx to the stomach. Hiatus is the opening through a structure, and then a band of muscle that encircles an opening. When it contracts, the opening squeezes closed. That is the definition of a sphincter. I believe the hiatus is the area within the diaphragm where the esophagus goes through the diaphragm and then is connected to the stomach. Sometimes you hear of a person having a hiatal hernia. This is where some of the intestines then, if there is any weakness around that opening where the esophagus is, the intestines can actually kind of move upward into almost like the chest cavity through the diaphragm. And that causes a great amount of pain. And it can cause a dangerous situation for patients, especially if that hiatal hernia goes up into the through the diaphragm into the chest cavity and then gets kinked off. That can cause a strangulation of the intestines, which is an emergency situation. So now we're going on into the digestive organs, stomach, small intestines, and large intestines. And so again, we know that the upper portion there of the stomach is where the esophagus is connected. And then you almost have like a J-shaped organ that the stomach is. At the end of the stomach, then that is where it then connects into the very first part of the small intestines, which is the duodenum. Again, there's a sphincter there as well. And again, the purpose of the sphincter is to allow the chyme, once it is formed, to flow forward into the duodenum. And ideally, we don't want anything going backwards from the duodenum back into the stomach. Now, of course, with different illnesses, different sicknesses, this can happen, but we don't want that to happen. That bottom portion there of the stomach where it's connecting to the duodenum, that is the pylorus. And therefore, then the sphincter between the pylorus of the stomach and the duodenum, that would be the pyloric sphincter. And so what is going on in the stomach? Lots of different things. Now, the stomach, keep in mind, is very acidic because of the hydrochloric acid that is formed by certain gastric cells within the stomach. Now, the stomach does have a layer of mucus that lines the stomach so that the hydrochloric acid does not actually break down the stomach itself. And in fact, there are certain disease processes that can injure this mucosal layer and then cause then the acid will end up, you will have sores in the stomach. We kind of sometimes think of those sores as ulcers. The bad thing there with ulcers, they're very painful. And also, if located near, especially a blood vessel, either a vein or an artery, if the ulcer kind of is bad enough, it'll go through into that blood vessel, and then you will have bleeding within the stomach. And so that is never a good thing. That can, in fact, if it's especially near an artery, it can cause massive bleeding. And if that ulcer is not, if the patient is not taken to surgery where there can be a repair of that stomach wall where the ulcer is, the patient can die from blood loss. So your mucus lubricates and protects the stomach itself. It lubricates the chyme also. The hydrochloric acid does break up the food. Pepsin helps digest proteins. There's an intrinsic factor that helps the small intestines absorb vitamin B12, and this is actually made within the stomach. And then gastric is a hormone that stimulates other gastric cells to produce pepsin and the hydrochloric acid and stimulates gastric motility. And so then again, we're continuing now. We talked about how the stomach will use the different chemicals plus the actual churning action of the stomach to turn that food bolus into chyme. And then after a couple of hours, a few hours within the stomach, that chyme normally then enters the first part of the intestines, which is the duodenum. Now, the small intestines is very interesting. It's made up of a lot of what we call villi. These are kind of like finger-like structures. It really increases the surface area of the small intestines so that there is all of the surface area for the body to be able to absorb the nutrients as that chyme goes through the duodenum, jejunum, and ileum. The duodenum is the first portion of the intestines, the small intestines. It's the first 9 to 10 inches. This is where the pancreatic juices or pancreatic enzymes and bile are kind of end up in the duodenum. That's where we have further breakdown of fat and further breakdown of all of your different macronutrients, proteins, and carbohydrates. The next larger portion of that small intestines, the jejunum, is about 40% of the length of the small intestines. This is where we do absorb a lot of our absorbing of food, chemical digestion taking place, allowing then to the body to be able to absorb those proteins, fats, and carbohydrates. The ileum makes up the last 55% of the small intestines. And of course, that is then connected to the large bowel. We sometimes refer to that as bowel or large intestines. So there is another valve that is located between the end of the ileum and then the beginning of the large intestines, and that is the ileocecal valve. That is at the ileocecal junction. Your intestines, they are in layers. They have a mucosal layer, a submucosal layer, the muscular layer, and that is where, of course, the peristalsis kind of takes place. Again, peristalsis is very important for the movement of the chyme throughout the small intestines. And then the actual outer layer covering the intestines is the serosa layer. Okay. Okay, and so let's go. So just again, make sure that you understand those terms there. I think we've gone over most of those. The jejunum is that middle portion of the middle of small intestines. The cecum is that kind of beginning portion of the large intestines. It is the blind pouch that is the first part of the large intestines. It's kind of that bottom portion of the large intestines. We'll see that here in just a minute. And of course, we know that what are we absorbing? So we have macronutrients. So the macronutrients are the carbohydrates, proteins, and lipids. Basically, we have three macronutrients that we need to have inside our bodies. Carbohydrates, of course, for energy. Lipids are very important for the basically, a lot of chemical process are based upon lipids and also just fat in general. We do need to have fat. We always say that we need to avoid fatty foods, but healthy lipids we do need in our bodies for proper body functioning. Proteins are very important. We can use those for energy, just as we can use really lipids for energy too, if we need to. We always think of carbohydrates, sugars, as our first source of energy, but both proteins and lipids can be broken down for energy as well, but they're also important for building. Proteins especially are important for building the body, building the organs, the muscles, etc. We know that we need water to stay hydrated. We need water to help perform all of the different chemical processes that go on in the body. And then vitamins and minerals are very important also within the body, a lot, especially for different types of chemical processes that go on. So, and all of that takes place as far as absorbing that from our food takes place basically within the small intestines for the most part. So, again, just make sure that you're reviewing your book for some of these terms. Remember ACE, ASE, when you see that at the end of a word, that is an enzyme. Enzymes are very important for helping chemical processes take place. Chyle is a milky fluid that results from the digestion and absorption of fats in the small intestines. Emulsify is breaking up very small droplets to suspend in a solution. Lacteal is a lymphatic vessel carrying chyle away from the intestines. And then lipase is an enzyme that breaks down fat. So here, so calcium, that is the first one. So the Ca is abbreviation for calcium. It is an important for muscle contractions. Calcium is important for the building our bones. So very important. ED here, emergency department. That's not sure why that is here, but okay. ED is for emergency department. The K, think about your periodic table in chemistry. K is for potassium. Mg for magnesium. Sodium is Na. And those are very, very important elements that we do ingest and that we do need to have in our diets. So I know a lot of people say that we eat too much salt. To people in our nation, especially, we like to add salt. Salt doesn't make food taste good. We can end up eating too much salt, but we have to have some salt in our diet. It's important. It is the most common extracellular positive ion that is in the body. So sodium is the most important extracellular ion in the body. And then when you think about potassium, it is the most important intracellular positive ion in the body. Potassium is very important in the heart. We have to have a balance of potassium in our blood for the heart to contract correctly. If our potassium ends up being too high or too low, it can interfere with the conduction system of the heart and cause severe dysrhythmias that can lead to death. So very important to have the correct balance of potassium in the body. If you're thinking about lab work, then lab-wise, if we're measuring serum levels, sodium, the normal level for sodium is 135 to 145. And the serum level range for potassium is 3.5 to 5.0. I want to say calcium is about 8.5 to 10. Magnesium is around 2.0, give or take. I can't remember the range there, but around 2.0. So those are, again, very important elements or ions that we have to have in our diet and that we have to have balanced in our body. And so then here are the different structures within the large intestines. We know that where the ileum is connected to that lower part of the large intestines that is with that ileocecal sphincter, the very first part is the cecum of the large intestines. At the very end of the cecum is the appendix. That is this little appendage that kind of just hangs down from the cecum. We don't exactly know why it's there. We are thinking that maybe along the way it lost its maybe it's a narrow tube with a closed end. It's a vermiform appendix. We really don't know the function of the appendix. We do know that sometimes and with illness, all of a sudden, if somebody is complaining of severe lower abdominal pain, if that pain is worse, not when you push on the lower abdomen, but you push down and then release, then that is rebound pain. And that is a sign of appendicitis, appendicitis being infection of the appendix. And so, really, the only cure for appendicitis is surgical removal of the appendix. So, from the appendix, you go upward the cecum, and then going upward along the right side of the body, that would be the ascending colon. And then as the kind of the colon then kind of turns and then goes across the body, the belly, that is the transverse colon. And then as it's going down towards the rectal area, so on the left side of the body, then it's going downward, that would be the descending colon. Then you have that small portion of the colon that's kind of connecting the end of the descending colon and the rectum. That would be your sigmoid colon, and then you have the rectum and the anus. And so then basically, remember, as the waste products enter into the cecum, there's a lot of water still mixed in with that. As that waste product travels through the intestines, water is reabsorbed by the body, and then you normally end up with a soft formed stool that exits via the anus. So the functions of the large intestines, we do still absorb water and electrolytes. There is a secretion of mucus within the intestines to kind of protect the layer of the intestines and then help keep fecal matter moving on through. Um, there can be some digestions by any remaining food products by bacteria. It is still that same term. Peristalsis is that muscular movement of the large intestines, pushing all of the waste products forward. And of course, then the process of elimination is then um, the unused food products being removed from the body via the anus. So, some terms here that we need to kind of understand. We already talked about colon can also refer to the large intestines. Colic is spasmodic, crampy pains in the abdomen. So really, colic refers to any pain that is within a tube. Um, Babies, for instance, sometimes newborns and babies when they're oh first first month, second month, third month of life, they can sometimes, especially in the evening, have really, really bad belly pains. You can tell my son had this when he was a little baby, and you could tell that he was really hurting. He would kind of almost bring his legs, his little thighs kind of up to his chest because of the pain. And there was some constipation issues going along at that time. So colic is when that crampy feeling, it's related to peristalsis, but it's almost like spasms. And it's that kind of peristalsis taking place, really trying to move things forward. But when it's in a colic type state, then that is really causing pain for the patient. So that's what colic refers to. Feces is just the also we refer to it as bowel movement. It's that undigested waste material discharged from the bowel. Fecal just means anything pertaining to feces, and the act of actually having a bowel movement is also referred to as defecation. Okay, so I'm going to, because I know this is a lot of material, we've already talked 30 minutes. I'm going to go ahead and stop share here, and then I will try to I'll make some at least one more video. I would like to focus on some of the diseases that are within the GI system. So thank you.